We also have some new important information tonight on a story the News 4 I-Team first broke. A rare syndrome in children linked to COVID-19. New York State just revealed 64 children now have it. News 4's Melissa Russo has been on top of this story since day one, and she's in the newsroom right now with a new alert, Melissa, from the state and an ICU doctor.
Yeah, David, and that number you mentioned, 64 children, coming as a surprise, I'm told, even to some senior state health department officials who, based on earlier manifestations of this virus, just did not anticipate seeing dozens of children critically sick. Racing to pediatric intensive care units throughout New York State, children in shock and in some cases even cardiac arrest. Children like 8-year-old Jaden Hardawar. As the I-Team learned today, New York State hospitals have reported treating at least 64 children with these serious inflammatory symptoms now believed to be linked to COVID-19.
These cases have come up, 1 to 2 per day over the last 2 weeks.
Dr. Steve Kearney runs the pediatric ICU at Morgan Stanley Children's Hospital in Washington Heights. He says he got a phone call yesterday from Governor Cuomo's state health commissioner, Dr. Howard Zucker.
What I've heard from him and from everybody is that this later onset disease is surprising to most of us.
On Monday night, the city sent an alert announcing 15 cases like this citywide. But Dr. Kearney says he's had more than 15 cases just in his uptown ICU, suggesting the city is undercounting cases. 1 week ago, the I-Team confirmed several additional cases at other city hospitals like Mount Sinai, NYU Langone, and Montefiore.
I want to thank Melissa Russo, who raised an important issue.
Mayor Bill de Blasio and his health commissioner were unaware of the local cases until we told them.
When we got the question from Melissa, I directed my staff to reach out to all of the pediatric providers.
And for the past week, we've been asking state officials the same questions and getting few answers. But yesterday, the state health department sent an urgent survey giving hospitals 24 hours to respond.
Start with facts first.
Governor Andrew Cuomo did not bring up the survey nor the 64 cases at his news conference this morning, but my colleague Katie Tur asked the governor about the subject during an interview on MSNBC this afternoon.
Has that potentially caught your health department off guard?
Well, I don't think it's caught anyone off guard, Katie. It's developing now. Apparently, they had a couple of cases in the UK on this. We're looking at it in New York. The information is all preliminary at this time.
Then the state sent an urgent alert to healthcare providers, laboratories, and hospitals, who are now required to immediately report these cases. Most of these children are testing positive for either COVID-19 or the antibodies. And Dr. Kearney says he thinks many of the children really had the virus 2 to 3 weeks earlier, but were asymptomatic and then developed an overactive immune response weeks later. David?
Melissa Russo, we look forward to more of your reporting on this important story.